Dr. Brian Smedley with Oasis ENT. I'm an ear, nose, and throat surgeon, and I can help you feel better in your day-to-day life. So anatomically, there's several different areas that can cause your nose to be obstructed, just that are anatomical that you can't change on your own. It could have been from you took a hit when you were a little kid learning to walk. You could have fallen and hit your nose, a basketball, a football to the nose. It could be something as simple as just coming out of the birth canal and your nose getting pushed. The way that you grow when there's been pressure on the nose can create some of those septal deviations and things that would be an obstruction that we can help with. We can make a massive difference. First of all, the septum is the middle part of your nose. It divides the left half from the right half. It's made up of a combination of cartilage and bone. At different times in your life, the end of your nose can get hit, and it can actually cause that septum to deviate. The younger you are, maybe coming out of the birth canal, that can put pressure, and the outside kind of bounces back and it looks normal. But on the inside, you might have a kind of a point of stress along either the cartilage or the bone, that as you grow older, that deviation becomes more pronounced. We can straighten it out so that on the inside of your nose, the left and right side, you can get air passing through. That's called a septoplasty. It's a simple procedure. You go home the same day. You recover for about a week and then you're feeling really good. Another cause of nasal obstruction is inferior turbinate hypertrophy. The turbinates are like pontoons that go down the sides of your septum. Septum's in the middle, turbinates are on the side. They can get enlarged just anatomically. They can get enlarged from environmental allergies, different exposures that you've had, infection. There's different things that can cause those turbinates to swell up. We can shrink those down. We can make it so those turbinates are not large anymore. You can be able to breathe well through your nose and things can function as they're supposed to. Another cause of nasal obstruction is nasal valve collapse. The side wall of your nose, when you sniff, it can collapse. There's things that we can do to help that as well. And sometimes that is collapsing because of the pressure of a deviated septum, turbinate hypertrophy. That airflow going through there can cause that nasal valve to collapse. Another cause of sinus pain and pressure is that the actual pathways that drain your sinuses are too narrow. The sinuses drain through narrow, bony chutes or tunnels, and you have sinuses in the forehead, called your frontal sinuses, maxillary sinuses in your cheeks, and you'll feel, when those are plugged, you'll feel pain down into your teeth. They all have to drain through a small area right in here. With our imaging and with our cameras, we can look in and see, and we can find out why yours are not draining appropriately. We can go into those areas and we can find those major openings in your sinuses, and we can widen them through a simple procedure that you don't even have to go to sleep for. You go home the same day. All right, so you've got nasal obstruction. It can be from any of those things. Come in and see us. We'll find out what it is, and we'll know what to do now.